From an evolutionary standpoint, the wrist stands out as a fascinating part of the human body. Over tens, if not hundreds of thousands of years, it has remarkably adapted to enable us to use tools and objects crucial for our species' survival. Despite not being a weight bearing joint, the wrist is a versatile tool that plays a pivotal role in our daily lives. It facilitates everything from powerful grips to delicate manipulations, showcasing its importance. But at first glance, even though it may seem pretty straightforward, anatomically, it's actually a marvel of complexity. It contains 8 carpal bones, arranged in 2 rows which intersect as the radiocarpal and ulnocarpal joints link up with the radius and ulnar bones in your forearm. And apart from that, nerve and artery pathways and numerous ligaments and tendons are prevalent, adding to how complicated it is. As such, given how much we use our wrists each day and their intricate anatomy, these are 2 reasons that they can become injured. So today we're going to discuss the possible causes of inner wrist pain. But first, as always, please take note of our disclaimer. Outside of a major trauma, pain at the inner wrist is most often a consequence of tendon or nerve problems. Relevant to the location, 4 tendons are the most likely culprits, stemming from the flexor carpi ulnaris, the flexor digitorum superficialis, the flexor digitorum profundus, and the extensor carpi ulnaris. These can become overworked if our hands are not habitually situated in a neutral position when performing an activity regularly. This makes these tendons more susceptible to handling more load than they're accustomed to, leading to degeneration over time and thus pain. But tendon problems don't just happen gradually. Besides degenerative tendinopathy, there's another type of tendon problem known as reactive tendinopathy, described as an inflammatory response where the tendon becomes swollen and irritated due to a sudden overload. Suppose you're someone who has just taken up a new activity lately that involves the use of the wrist quite a lot, like tennis or pickleball. Alternatively, if you have meaningfully increased the intensity, duration, and/or frequency lately of a sport you've done for quite a while already. In that case, it's probably more of the latter kind of tendon problem you're dealing with. Then, from a neurological perspective, the inner wrist pain could be due to a disturbance happening with the ulnar nerve in particular, since it innervates the region. If you have tingling, numbness, pain, and even weakness in the ring and little finger accompanying the inner wrist symptoms, it's a good bet then that the problem is nerve related. The ulnar nerve medially runs into the hand from the forearm through a small tunnel known as Guyon's canal. As such, anything that results in this tunnel becoming pressured can negatively affect the nerve and provoke the associated symptoms. However, it's more frequently the case that people will have neurological pain in the region without issues at this canal. That's because compression or irritation of the ulnar nerve further up its pathway towards the neck can still cause pain downstream to the inner wrist. The most common area where this happens is at the neck, but there are other potential problematic sites at the chest and at the elbow, specifically the cubital canal. So that's the 2 most likely causes of inner wrist pain, but there are other potential ones to keep in mind too, outside of a significant trauma experience. On a quick side note, if you are interested in undertaking our evidence-based and results-backed personalized plate weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. For one, there's a structure made up of cartilage, ligaments, and fibrous tissue located between the ulnar and carpal bones at the inner wrist that assists with wrist stability and load distribution. It's called the TFCC, and it can also be damaged from repetitive use. For 2, arthritis relating to both osteoarthritis and rheumatoid arthritis can be a cause. With OA, wear and tear of the cartilage in the area over time can contribute to pain, whereas with RA, the immune system can target the lining of the joints in the area, creating inflammation and therefore pain. For OA, even though it's the most common musculoskeletal disorder worldwide affecting the hands, if you're relatively young, this most likely won't be the reason since it primarily occurs in the elderly. The onset of rheumatoid arthritis, on the other hand, can happen at a younger age, but it's much less prevalent than osteoarthritis, with about 10 to 15 times less prevalent. Moreover, inner wrist pain can develop from ganglion cysts too. These are fluid-filled sacs with an uncertain etiology, but are believed to come from repetitive microtrauma. They are commonly found in women between the ages of 40 and 70 with osteoarthritis. Indeed, the majority of these are asymptomatic, but patients can present with pain from them. They can place pressure on surrounding structures and cause localized inflammation and pain. And lastly, despite again being a less likely cause of inner wrist pain, there is a possibility of Kienböck's disease. This condition refers to a vascular necrosis of the lunate carpal bone. Remember we mentioned that the wrist is composed of 8 carpal bones intersecting with the radius and ulnar? Well, of these, the lunate bone is slightly inner to the midline of the wrist. A vascular necrosis means that the normal blood supply to a bone has been disrupted, causing the bone to die over time. This results in pain, stiffness, and limited wrist movement. It happens as a consequence mostly due to trauma or vascular abnormalities, but repetitive stress can also be a factor. But rest assured, this condition is rare. One study suggests its prevalence is only about 0.0066%, or, in simpler terms, only about 7 in every 100,000 people. Overall, if you have inner wrist pain that has had a gradual onset, it's probably caused by a tendon or nerve problem. To help clarify which one it may be, which is important as the treatment will be different for each, we recommend consulting your local physical therapist to get your wrist back to optimal health as soon as possible. Have you had inner wrist pain previously? What did you do to help it? Or did it just gradually disappear over time? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.